Hey guys, it's Dr. Nate here, and I want to talk to you today about what you should know before you do Candid, before you do Smile Direct Club, before you do Invisalign, before you even do braces. So today I'm going to explain to you the top reasons you need to see an orthodontist before you start any of those treatments. Alright guys, so like I said before, I think it is very important to work with an orthodontist if you're going to be doing anything that involves moving the teeth. And this is with Smile Direct Club, this is with braces, with Invisalign, with Candid, with any of those do-it-yourself type products. I think this is important, okay? So today we're talking about mainly the do-it-yourself kind of versions of this. This is Invisalign, which can be done by your provider, by your orthodontist. But this is mainly in regards to kind of do-it-yourself type of products. Okay, so number one, why do I say go to an orthodontist? Well, number one is because an orthodontist does this every day, all day. That is literally all we do. So I have people that ask me, hey, are you doing fillings? Are you doing extractions? Are you doing crowns, bridges? Nope, we're not doing any of that. All we do is we do Invisalign, we do braces. Some people do lingual braces, different version of braces, but that is all we're doing all day. So you can imagine if somebody is just dabbling in it, so you have a dentist or one of these salespeople at these other offices, they're dabbling in it. You know, they may do 1 or 2 or 3 cases a week or a month or whatever. We are seeing, yesterday I saw 60 patients. That's in one day. So you can just imagine the amount of patients we see and the expertise we get after we see that many patients. That's why I always emphasize, I say, hey, if you're gonna get something done, even if you're not in like the Dallas-Fort Worth area and you're not coming to see me, definitely go see an orthodontist just because their expertise is so much better. You are gonna get the best product, best result possible. Ideally, you are just doing this once. And we all know how important a smile is. People say that when you look at somebody, the first thing you notice is their teeth. We've all known those people who go, when they smile, instead of like giving a nice big smile, they kind of cover their mouth and laugh and ha ha ha. I mean, the reason they're doing that is because they're not happy with their smile. So it makes sense to get the best possible smile you can with an orthodontist who's the most trained. The next thing is you want to be able to talk to somebody, and this is number 2, and this is a big one because we get actually a lot of patients that come from Smile Direct Club or any of those other do-it-yourself companies, and what they've told me basically every single time is you can't talk to anybody. It's like going to your doctor's office and being like, hey, I have a heart condition or a heart problem, and you literally never talk to the doctor. That makes no sense to me. So I think when you're going in there, you think, hey, these are gonna be good, like things are gonna make sense, and then stuff starts happening, you're like, yeah, I need to talk to somebody, I need to make sure that we're on the right track, we're doing the right treatment plan, and you can't really do that. They just go, okay, cool, take some more impressions, and we'll see you later. And with the impressions, it kind of blows my mind too, is that you do it at home. And I know I've said this in other videos, but taking impressions is hard. It is really hard to get a good impression. And once again, this is what we do all day, every day. So if you aren't practicing this all the time, you're not good. There's basically 0 chance you can do this at home by yourself and do it well. I mean, it's just, I can't do it at home by myself and do it well. So I think that is really important to go to a professional that does this. The other thing is you need to talk to them about your treatment plan. And this is vital when you're trying to do different things with your bite or with your smile, and you have different things missing. So we'll get a lot of patients that are missing teeth. They have small teeth. Their bite's really off, all these different things that if you can't talk to somebody, there's no way you can figure out the proper treatment plan. So some people may have small laterals, we call them small kind of side teeth right here. And sometimes we can work that. We can slim the bottom teeth to kind of make the bite really good, or we can open it up so they can get crowns or veneers or anything on those front teeth. But how are you going to communicate that with an orthodontist or whoever is behind the computer screen? Because you can't see them, you can't talk to them, you can't talk to them about your treatment plan. Maybe we're making space, maybe we're closing spaces, maybe we're adjusting the bite so that your restorative needs are going to be better. All these things are important, so you need to be able to talk and treatment plan with your orthodontist to make sure your treatment plan is the best. The third thing I think is very important is you want to be able to go to an orthodontic office. Ideally, honestly, that has a dentist in it, or they're very closely affiliated with the dentist. And this is the reason. Because we get tons of people coming in and they say, cool, I want to straighten my teeth, yet they haven't seen a dentist for a year or 2 or 3 or more. And that's totally fine. It's okay to have not seen a dentist. That's what we're here for. That's what we're here to help you. But it is important for you to see them first so we can get a good proper treatment plan. So some people will come in and say, cool, I'm ready for braces. And I go, cool, when's the last time you saw a dentist? When's the last cleaning? And they'll go, yeah, it's been a while. And I go, okay, so let me take a look at these x-rays. And you see the x-rays pulled up. You should always have x-rays taken before any braces, Candid, small direct club treatment. That is also very important. I know I say a lot of things are important, but that is very important because with the x-rays, like I'd explained to this patient, you can see bone level, you can see if there's missing teeth, you can see if there's extra teeth. You can kind of tell different things with that patient. So they'll say, cool, I want to start braces treatment, and I'll go, yeah, but look at this x-ray. You know, you have no bone, you know, the tooth is mobile, or you're missing that tooth, or hey, there's a tooth stuck underneath there. So if you don't take an x-ray before you do these things, you can move teeth and you can severely damage teeth. And you can actually need to take out a bunch of teeth because you didn't take proper x-rays. And that happened to actually a friend of mine. A patient came in from Small Direct Club and the teeth were excessively mobile, you know, like moving like this. And he tries to kind of figure out what's going on. He's like, hey, what did your dentist say? What did the x-ray show beforehand? And they're like, yeah, they never took x-rays, so I have no idea. And that blows my mind, for you to do treatment on yourself, on your mouth, without taking x-rays. It's like doing surgery on yourself, or like doing, I don't know, arm surgery or heart surgery and not knowing what the heck's going on in the heart or in your body. It makes zero sense to me. So that is why I think it is important to work closely, have an orthodontist. Ideally, the orthodontist and the dentist are in the same office because it just makes communication very easy. Or if the orthodontist and the dentist are closely related, you know, they're talking all the time, they can easily do treatment plans back and forth, that's fine too. I just like it for us, we have a dentist always in the office, just so it makes it really easy. I can go, hey, Dr. Vu, I know I have this patient here, we're gonna do this blah, blah, blah treatment. Can you do a quick exam on them to see, hey, maybe this is better for an implant, or do you think we should do a bridge, or do you think we should do crowns, or what do you think we should do? So that is why I think it is vitally important to see an orthodontist before you start any treatment, and this involves the do-it-yourself treatment, this involves braces, Invisalign, the Smile Direct Club, Candid, any of those, you must see an orthodontist for this. All right, guys, so that is my top 3 reasons I think you should know this before you're doing any of the do-it-yourself type of treatment. Number 1, you want to see an orthodontist just because you do it all the time. You want to be able to communicate your treatment plan with that orthodontist. You want to be able to talk to them. You want to be able to make sure that you guys are on the same game plan. What if they just do something that's totally opposite of what you are doing? That is not good. Number 2 is you want to have a good orthodontist who has a good relationship with a dentist. So you want them to be able to communicate so they can, once again, develop an amazing treatment plan to make your results as good as possible. And the last thing is, I know I mentioned this number 2, but I think this is one of the most important things. You need to have x-rays taken before you do anything. It's just, you need to. There should be 0 exceptions because you need to see your bone level, you need to see if there's extra teeth, missing teeth, what you're gonna do with things. It's just flying blind if you don't have an x-ray before you start treatment. All right, guys, so that is my advice. Seek an orthodontist. The do-yourself, I don't think is good for majority of the people. We have amazing payment plans here. We can get you started for like $130 a month. Some people, if they have good insurance, are paying 0 down. I mean, there's really no reason not to start braces here. Once again, it's Dr. Nate here at Thrive Dental and Orthodontics. If you have any questions or concerns, please let me know. Please subscribe, and we'll be back very soon. Thank you guys so much.